The United Nations Children's Fund (UNICEF) says the introduction of multiple micronutrient supplements (MMS) for pregnant women in Nigeria will reduce the high rate of maternal and infant mortality. The chief of nutrition said one of the worries of all public health and nutrition practitioners is the high rate of maternal mortality and neonatal and infant mortality, a situation which can be reversed through MMS. She said that the organization was working with the government to develop the step-by-step processes on how to transition appropriately.
With the introduction of MMS, we could actually reduce and have an impact on both. Because if a mother is healthier, then her chance of death during pregnancy and at birth reduce. Similarly, if a child is born full term, a child is born healthy, then the probability that that child will die within the first few days of life or even within the first year are significantly reduced. So if we want to preserve the health of our women and children in Nigeria, especially in those early years and days, then this is what I would call a best buy in public health. The first 1,000 days from pregnancy to the time the child is 2 years of age is a very important period in terms of our growth as human beings. And when I say growth, I don't just mean physical growth, but also mental growth. When a woman is pregnant, she needs to preserve her own health so that the health of her child in uterus can be healthy. So multiple micronutrient supplements gives her that boost and gives her all the vitamins and minerals she needs for her own health to begin with. When a child is growing in the uterus, if a child doesn't get enough nutrients, we say the child gets born small for their gestational age, which means they're already malnourished in the womb. We have seen that with multiple micronutrient supplements, the proportion of children who are born small for gestational age reduces. We also know if a mother is not well nourished, then there is a risk for her to have a preterm baby or a stillbirth baby. So we've also seen that with MMS, there is a reduced risk, a reduced incidence of preterm and stillbirth. There's also a reduction in low birth weights. So babies who are born low birth weight, that is less than 2.5 kilograms, are at higher risk of infection and even potentially death. So the effect or the impact of MMS on the mother and the child so that they're both healthy and grow well is tremendous. One of the most important needs that a woman has when she's pregnant is that for iron. And in many countries also we know that for the child to develop you need folic acid. So over time the world came up with iron and folic acid supplements. And that was the commodity or the pill that we would give pregnant women to ensure that their health was preserved and that of their child would be healthy. So iron and folic acid supplements, or IFAS as it's called here, contains iron and it contains folic acid. A multiple micronutrient supplement contains 15 different vitamins and minerals. So it contains iron, it contains the folic acid, but it also contains other vitamins such as B12 and many B vitamins and many other good nutrients. So there's 15 different ones. What we're realizing is that women in general need the multiple nutrients. They need not just the 2, but the 15. And we have seen globally that when a woman is given iron and folic acid supplement, and if a woman is given multiple micronutrient supplements, the health of the mother is much better with MMS, as well as the birth outcomes. So there is a reduction in low birth weight, in preterm, in stillbirth, and what we call small for gestational age. You need to have the financing to make sure that you can transition. You also need to make sure that you have the commodities. Right now, MMS is not produced in Nigeria. Iron and folic acid is produced. So on all these fronts, and you need to have, while Nigeria is very good on policies, you also need to have MMS in like the essential medicine list, in the antenatal care guidelines, in the training manuals, so that we don't do anything that is not within the policy. So whether it's on the policy, whether it's on the delivery of the commodity, whether it's on the financing, or whether it's on the product availability and supply, I would say across all these pillars, UNICEF as well as other partners are working to support the government.
Also, the Director of Nutrition, Federal Ministry of Health and Social Welfare, said that, according to the 2018 National Demographic Health Survey, about 61% of pregnant women in Nigeria were anemic, which has an impact on the unborn child. She also said that, just like the iron and folic acid supplements (IFAs) were distributed free of charge to pregnant women in public healthcare facilities, multiple micronutrient supplements (MMS) would also be dispensed free of charge when it is fully operational.
In Nigeria, in 2021, the National Guideline on Micronutrient Deficiency Control was revised to include that pregnant women should be given multiple micronutrient supplements through the antenatal care platform. So every woman that goes for antenatal care will be provided with multiple micronutrient supplements. However, between 2021 and now, the government, in collaboration with stakeholders, have been working to get evidence to show that multiple micronutrient supplements will be beneficial to the women. We are now doing a gradual transition from IFAs to MMS, and we are starting in batches. We are currently carrying out implementation research in Bauchi. But government has planned to carry out the implementation research in all the 6 geopolitical zones. As we speak, the data collection tool has just been pre-tested in some communities in the Federal Capital Territory. The federal government is implementing nutrition projects, we call it ARIN projects, in 12 states. And plans are on to also carry out implementation research in these 12 states. So the findings from all the states on the adherence, are the women ready to transit, how affordable will it be, how accessible will it be? But the government is going to use the platform of IFAs. Every pregnant woman goes to the health facility during ANC and gets IFAs free of charge. So the same thing will be done for MMS. From public facilities, the pregnant woman will get it free of charge. So in terms of affordability, it will be affordable. In terms of accessibility, it will be accessible. But we're doing it in phases. We're not stopping the use of IFAs.